I'm going to go ahead and do my room scan. I have the provider order book. I have all of my one-pagers, and then I have my lab values. Then I have Joe over here and nothing over there. I'm going to go ahead and get started. There we go. Knock, knock. Hi, I'm Hannah. I'll be your nurse. Today I would go ahead and pull the privacy curtain. Can you tell me your name and date of birth? All right, and do you have any allergies? All right. So I'm verifying on his bracelet that he's Joe Smith, date of birth of 10/5/19/5X, and sulfa as the allergies. I will be wearing PPE later on in this procedure. I'm going to go ahead and verify doctor's procedures. All right, Joe, it looks like I'm here to be giving you your medications today. Do you have any concerns about that or any questions? Okay. And how do you prefer to take your medications? Orally? Okay. With water? Right. And then are you sitting in a comfortable position? Yes? Okay. I do have Joe upright, so it would be safe to give him his meds. And then Joe, do you have any pain today on a scale of 0 to 10? 0? No pain? Okay. Right. So, Joe has no pain, and then I would also do necessary assessments. I would make sure to get a cardiac assessment. I'd be sure to get the apical pulse. For today, we're going to say everything is within normal limits, and we're going to say the apical pulse is 65. At this time, I will go ahead and assess the doctor's providers to the MAR. I have Joseph Smith, digoxin, also known as Lanoxin, 0.125 milligrams orally daily for congestive heart failure and atrial fibrillation. It is active, and that matches the MAR. I have Joseph Smith, furosemide, Lasix, 40 milligrams orally twice a day for congestive heart failure. It is active, and that also matches them over here with the MAR. And then I have Joseph Smith, warfarin, Coumadin, 5 milligrams orally daily for atrial fibrillation. It is active, and that matches with the Joseph Smith MAR of, we have Joseph Smith, digoxin, Lanoxin, 0.125 milligrams. Joseph Smith, furosemide, Lasix, 40 milligrams orally twice a day for congestive heart failure. Joseph Smith, warfarin, 5 milligrams orally daily for atrial fibrillation. Doctor's orders also has a few PRN medications of Joseph Smith, Tylenol 3, orally every 4 hours for a pain rating of 1 to 4, and it is active. And we have Joseph Smith, Percocet, orally every 4 hours PRN for a pain of 1 to 4, and it is active. Since Joe has no pain today, we will not be giving him those medications, the PRN medications. They were given over 4 hours ago, so it would be, they would be due now and be safe to be given, but we will hold those as he is not experiencing any pain. I'm going to go ahead and assess the med cart. I have Joseph Smith, digoxin, Lanoxin, 0.125 milligrams orally daily for congestive heart failure, atrial fibrillation, and the status is active. It is due now and it has not been given. I have a digoxin 0.25 milligram package. We would go ahead and cut that to have the appropriate dosage of 1.25. The packaging is intact and expiration is 04 of 2041, so that would be safe to be given. And then we have Joseph Smith, furosemide, Lasix, 40 milligrams orally twice a day for congestive heart failure and is active. We have 2 packages as they are 20 milligrams, so we'll give 2 to have the appropriate dosage of 40 milligrams. So Joseph Smith, furosemide, orally 40 milligrams twice a day for congestive heart failure. It's active, it's due now, and it has not been given. Both packages are intact, and the expiration date is 08 of 2038, so that's safe to be given. And then we have Joseph Smith, warfarin, also known as Coumadin, 5 milligrams orally daily for atrial fibrillation. It is active, it is due now, and it has not been given. I have a warfarin 5 milligrams, so that's the correct dosage. The packaging is intact and the expiration is 04 of 2041, so that would be safe to be given. Now I'm completed with my first check. I will go ahead and assess lab values. And again, all assessments and vitals were within normal range, so as far as that, it's safe to give medications. Okay, so it looks like Joe's DIG level today is 0.6, so 0.6, so I would go ahead and I would like to hold the digoxin today and consult with Joe's provider. And then Joe's INR levels are 3.4, so that is a little high, so I would go ahead and I'm going to hold the warfarin today and consult with his provider before moving forward with that. Joe's potassium level is 3.5. That is within therapeutic range, so we're going to go ahead and give Joe the furosemide. So again, due to Joe's lab values being a little concerning, I'm going to consult with his provider about holding the digoxin and warfarin. At this point, I'm going to put the digoxin and warfarin to the side, since furosemide is the only medications I am giving, also because, again, the PRN medications will not be given as he has no pain. I'm going to go ahead and scan both of these furosemide packages. So I'd scan, and now I'm starting my second check. I have Joseph Smith furosemide, also known as Lasix, 40 milligrams orally, twice a day for congestive heart failure. It is active, it is due now, and it has not been given. Again, I have two 20 milligram tablets to have the correct dosage of 40 milligrams. At this point, I'll go into Joe's room. All right, hi Joe, I'm back. So I'm here to give you your meds. Just to remind you, we're not giving you any pain meds, your PRN medications, as you are not experiencing any pain currently. And then we're going to go ahead and hold your warfarin and digoxin, and I'm going to consult with your provider about your lab values. Is that okay with you? Okay. At this point, I'm going to start my third check in Joe's room. I have Joseph Smith furosemide, also known as Lasix, 40 milligrams orally, twice a day for congestive heart failure. It is active, it is due now, and it has not been given. I would go ahead and apply my PPE. And before giving Joe his medication, I'm going to just tell him why we're giving him the meds today. All right, Joe, so today we're going to give that furosemide, so that helps to inhibit resorption of electrolytes of sodium and chloride. So also, in easier terms, it helps to decrease the edema, and this is for your congestive heart failure. And then common side effects, you can experience rash or loss of hearing, nausea. More severe things is such a thing of Stevens-Johnson syndrome. If you do experience any of those, I'll have you let us know right away. Or if you're just having any abnormal feeling or side effects, let us know. I'm putting on my gloves. And I have collected all my necessary equipment and cleansed everything. I would go ahead. Here's your furosemide and here's your water, Joe. I would stay with Joe until he takes his medication, and then it takes 15 minutes for sublingual meds to act and 30 minutes for oral meds to act. If there were any adverse side effects, I would go ahead and hold his next dosage. I would take all necessary assessments. I would contact the provider, contact the pharmacy, and document per agency policy. At this time, I'm going to go ahead and document in the MAR. I will put today's date and the time. And my initials. And I'm circling my initials for digoxin and warfarin as we did not get those medications. I would cleanse any equipment I used today. And then, Joe, is there anything I can do for you? No? I have time. Okay. I would lower the bed, make sure the brakes are locked, make sure the bedside rails are secure, place the call light within reach and bedside table within reach, make sure the floor is free of any falls, and then I would go ahead and provide hand hygiene and document as necessary.